Are voice changes a common thyroid symptom? Voice changes are indeed a common symptom associated with thyroid disorders. This is especially true for conditions like hypothyroidism and hyperthyroidism. Research shows that a significant number of patients with thyroid dysfunction experience changes in their voice quality. In fact, studies indicate that about 27% of individuals with hyperthyroidism report voice alterations. For those with hypothyroidism, the numbers can be even higher, with estimates ranging from 9% to 38% experiencing voice symptoms. In severe cases of hypothyroidism, up to 80% of patients may report issues with their voice. So, what kind of voice changes can occur? Patients often describe symptoms such as hoarseness, breathiness, vocal strain, and reduced vocal range. Some may experience vocal fatigue or notice their voice becoming deeper or rougher. These changes stem from the effects of thyroid hormone imbalance on the vocal folds and laryngeal tissues. For instance, in hypothyroidism, there can be an accumulation of mucopolysaccharides in the vocal fold tissue, leading to fluid retention. This results in heavier and less flexible vocal folds, which can create a characteristic deep and irregular voice. Interestingly, the presence of thyroid hormone receptors in the larynx indicates that thyroid function has a direct impact on voice quality. Fortunately, many voice changes improve or resolve within 3 to 6 months after thyroid hormone levels are normalized through appropriate treatment. However, it is important to note that voice changes can persist even after thyroid surgery, known as thyroidectomy. Studies show that between 14% and 75% of patients report ongoing voice symptoms months after the procedure. This highlights the need for careful management and monitoring of voice health in individuals with thyroid conditions. In summary, voice changes are a recognized symptom in thyroid disorders, particularly hypothyroidism. They should be considered during the clinical evaluation and management of thyroid disease. Addressing thyroid hormone imbalances often leads to improvements in voice symptoms, but if changes persist, further assessment by specialists in voice and laryngeal function may be necessary. Always consult healthcare professionals for personalized medical advice regarding any symptoms you may experience.